Hello, friends. How are you all? So, I think one of the important aspects today we're going to cover that is regarding the antigen or antigen pe a lot of questions they do come. Okay. So, antigen ka basics I will tell you in a very short and sweet way. Okay. So, first of all, what is an antigen? You should know what is an antigen. Antigen is a lot of questions they do come. Antigen is a any foreign substance which induce antibody formation under what? Under optimum condition. Okay. Means any particular thing which comes in our body and induce of what? Antibody formation. But important is what? Under optimum condition. And those optimum conditions are what sort? They should be, that is optimum pH, optimum temperature. So that particular thing should be optimum. Then only the antibody will be produced. So that is what is the logic of this particular stuff. That is the antigen. Okay. This particular antigen is also said to be immunogen because it induces what? The antibody formation. Okay. Now, hapten. This particular word also you will see again and again that what is hapten? Hapten is a incomplete antigen. What is a hapten? Hapten is a incomplete antigen, and this incomplete antigen is not capable of inducing what? Antibody formation. Okay, this particular hapten is not capable of producing what? Antibodies. What it needs? It needs a carrier protein. Okay, what it needs? It needs a carrier protein, and then only it is immunogenic. Then only it is immunogenic. And you have got the idea that what is immunogenic? Immunogenic is which induce the antibody formation. Okay, so hapten is an incomplete antigen like our lot of these metals, nickels and all. They takes the skin proteins, okay, as a carrier protein, and they become immunogen later on. And that is what is the story of what? Contact dermatitis in type 4 hypersensitivity, if you remember. Okay, so that is what is the story of hapten. Now, what is the smallest part of the antigen which like gets with the antibody? Means the antigen, which smallest part touches of the antibody, which particular part? So guys, you should know this name also, that there is a substance termed as what? Epitope. Okay, this is a structure made up of amino acid that is there in the mostly the antigens are proteinaceous, so they have this epitope, and this epitope is a part, small part of an antigen which attaches to the paratop. Okay, which attaches to what? Which attaches to a paratop. Paratop is a feature of what? Antibody. Okay, so epitope, just remember like this, from above the antigen comes which have epitope, and paratop is with antibody. Okay, body par. Okay, so body have par, so paratop is a part of antibody and antigen is there in the epitope. Okay, so this should be very much clear to you. Now, other than that, which are the various factors which affect the immunogenicity of an antigen? Okay, कौन से factors हैं which affects the immunogenicity of an antigen? Okay, so guys, to know that particular stuff, you should know that there are important four stuffs which affect the immunogenicity of an antigen. What are those? The first is the nature of the substance, means what it is made up of. Okay, that particular antigen or an immunogen is made up of what? So that particular thing matters. And the best antigens are what? The best antigens are proteins. Okay, the best antigens are proteins. The second best are carbohydrate. Okay, second best are carbohydrate. Then you have lipids, and the last one is what? Nucleic acid. Okay, the last one is what? Nucleic acid. So this you should know that Proteins are the best antigens. Then comes the carbohydrate, then the lipids, and then comes what? Nucleic acid. And in the nucleic acid, what we have? We have like these particular DNA of ours, and you know, a disease in which antibodies are produced against this nucleic acid. And what is that disease? That disease is SLE. Okay. So actually it is good for us that they are poor antigens. Otherwise, it's a big problem for us, guys. Hai na? So that is what is the story. Proteins are the best antigens. Second number is carbohydrates. Third is lipids. And the fourth one is nucleic acid. So that you should know first of all. Then, second point is more the molecular weight and more the size. Okay, more the molecular weight and size, more it is immunogenic. Okay, more the molecular weight and size, more it is what, guys? Immunogenic. You should know that. Okay, means like hemoglobin and all. It is a complex structure. So, more the molecular weight and size, more it is immunogenic. So, that also should be known to you. The third one is the tissue enzyme response. Okay, the tissue enzyme response. Tissue enzyme response means what? That how does our tissue enzymes degrade that particular antigen? That also matters. Okay, and because of this, like various genetic factors and all, you process an antigen in some way, I process an antigen in some other way, and that's why our antibody titers are different. Because you have also taken COVID vaccine, me have also taken COVID vaccine, then why our titers are different? This is the nature. Tissue enzyme response of ours and the genetic factors which governs these particular ones. Is it fine? So remember this important point, the tissue enzyme response is also matters in the immunogenicity of an antigen. Other one is the foreignness. More the foreign antigen it is, more it is immunogenic. Means in the humans, if you're putting up the animal antigens, it will be more immunogenic. Antibodies will be produced more. Okay, but the problem of foreignness is it is also directly proportional to hypersensitivity. Okay, so if a rabies patient comes to you, like a suspected rabies patient, and you give the equine rabies immunoglobulin, okay, so that also acts for the body as what? Like an antigen, and that too as a foreign antigen. Okay, good it is that it will be having good response, but the problem is it can be what? Hypersensitive also. So basically foreignness is good for the immunogenicity, antigenicity, but foreigners have a problem, and foreigners have a problem of what? It have a problem of hypersensitivity. Fine. So remember this particular point also. Okay, so I suppose now you're clear what is antigen. Antigen is a particular thing which produces antibody but under optimum conditions. Optimum conditions means what? Optimum pH and optimum temperature should be there. What is a hapten? Hapten is an incomplete antigen which needs a carrier protein to be immunogenic. Okay, then there is the epitope. What is epitope? A smallest part of an antigen which is made of amino acids obviously, which attaches to the paratop of an antibody. Okay, so epitope, from above the antigen comes and attaches to the antibody. Which region? FAB region of the antibody. That we'll discuss in the next regarding the antibody. What are the various factors which affect the immunogenicity? The nature of the substance, more molecular weight and size, tissue enzyme response, foreignness. This question will come. Okay, and here only I like to tell up one more complex thing which you mostly don't understand. What is that? That is the heterophile antigen. Okay, that is the heterophile antigens. Okay, guys, so this might be a short note for you that heterophile antigens are what? Heterophile antigens are those which are the antigens possessed by two different families. Like we have seen up that the protease antigens, they are being used in the diagnosis of typhus fever. Yes or no? Rickettsial fevers. So protease antigens, they cross react, okay, with the rickettsial antibodies. Okay, they cross react with what? Rickettsial antibodies. And why they cross react? Because they share the antigens. Okay, because they share the antigen. This is what is the logic of heterophile antigens. Means you know Proteus. Proteus is an Enterobacteriaceae member. Okay, Rickettsia is altogether a different family. but still they are sharing their antigens. Means their relation is not of this birth. There are previous birth relation between them, and that is what is the story of heterophile antigens. So that's why we use proteus antigens to find out what the various rickettsial diseases. Is it fine? And that's why the famous example, that is OXK, is strongly positive for which particular disease? Scrub typhus. Okay. OXK is strongly positive for what? It is strongly positive for this particular scrub typhus. OXK. This OXK is a protease antigen and it is strongly positive for which particular disease of rickettsia? Scrub typhus. Remember like this K and this make you this K. Scrub. OXK is strongly positive for this scrub typhus. Remember this particular point also, guys. Okay. Now, this is what is the example of heterophile antigen. If at all this question comes, you should write up this example, and this particular one you can give as an example. This is known as Weil-Falix reaction. Later on, we'll study this, that what is the name of this heterophile reaction. The name of this heterophile reaction is what? Weil-Falix test. And in the Weil-Falix test, what we use? The protease antigens we use to diagnose of what? The rickettsial disease. And why we do so? Because they share their antigens. And why they share up? There is a relation between them. Not of this birth, previous birth. Because in this birth, they are born up in different families. But previous birth relation they have. That's why we say that they induce of the antibody production. And that's why they cross react. Is it fine, guys? So this is what is the logic of heterophile antigens. And today for the last thing is super antigens. What is super antigen? Super antigen is that particular antigen which is super. In what sort it is super? It attaches to the TCR. TCR is what? T cell receptor. And on which side of that it attaches? On the lateral side. Lateral side of V beta domain. Okay, it attaches to the lateral side of V beta domain. And what is V beta domain? Variable beta domain. What is V beta? Variable beta. Is it fine? So by the picture, you can see that super antigens, they come and they attaches into this particular region. This is, suppose this is a super antigen and this is TCR, and this super antigen is coming and binding where? On the lateral side. And this lateral side is which domain? V beta domain. As you can see this is V beta domain, variable beta domain. And this variable beta domain does what? This variable beta domain induces more than 20% T lymphocyte activation of the body. It induces what? More than 20% T lymphocyte activation, which leads to what? Massive lymphokine release. Which leads to what? Massive lymphokine release. And this massive lymphokine release leads to what? Shock. This is what is the story of what? Super antigen. So remember, super antigen attaches laterally on which domain? V beta domain, and activates how much? They activates more than 20% T lymphocytes, and that leads to what? Massive lymphokine release, and that's why leads to what? Shock. This is what is the story of super antigens. Certain examples if you take, then the staphylococcal toxins, they are the examples of the super antigen. Everybody knows that TSST1, that is toxic shock syndrome toxin 1, okay, which is associated with the uses of contaminated vaginal tampons and menses and all. Previously, it used to be a triggering factor a lot. But remember, nowadays it's very less. But still, you should remember up this example, TSST, toxic shock syndrome toxin 1. Other than that, what you have, guys, other than that, in the new book, what have come? Even the food poisoning toxin, ETA, that is also the super antigen. Okay. And the other one, that is double S, double S. Double S is what? Enterotoxin or exfoliatory toxin A and B. This also can behave like a super antigen. So basically what you need to know, that these staphylococcal toxins, all they are capable of inducing what? Super antigenicity, which is always a super antigen. Always a super antigen is TSST1, and which may be super antigens, may be listed of food poisoning and staphylococcal skin scalded syndrome. Double S, double S. I suppose this particular thing is clear. Then you have the streptococcus. Streptococcus, the one which does scarlet fever, the toxin, pyrogenic toxin, A and C. What is the other name of this? Pyrogenic toxin A and C. That is the one which associates with streptococcus, and it does what? Super antigenicity. Induces more than 20% T lymphocyte release, lympho activation, and thereby leads to what? Massive lymphokine release. Mycoplasma, one species is there which behaves like a mitogen, and the name is Mycoplasma arthritis. That is there. Then you have Malassezia furfur or furfur, whatever you call it. That leads to what? Tinea versicolor. This can also behave like a super antigen. Yersinia enterocolitica. Okay. Yersinia enterocolitica or Yersinia pseudo TB. These two names of the Yersinia species, they can behave like a super antigen. Remember this particular fact also. Epstein-Barr virus, okay, sometimes. Cytomegalovirus, that is human herpes virus 5. Epstein-Barr virus is what? Human herpes virus 4. Okay, and even the HIV virus, this can also behave like a super antigen. Okay, this can also behave like a super antigen. Okay, means Epstein-Barr virus, cytomegalovirus, HIV virus, rabies virus. These are the various ones which behaves sometimes as super antigens. Okay, which behaves sometimes as super antigens. So this is what is the story of what? The various examples. The super antigen. If the super antigen comes as a question to you, then you have to mention up these particular names. Okay. Staphylococcal all toxins, Streptococcus pyrogenic toxin A and C, Mycoplasma arthritis, which behaves like a mitogen, Malassezia furfur, Yersinia enterocolitica or pseudo TB, Epstein-Barr virus, cytomegalovirus, HIV, and rabies virus. These are the various examples which you need to remember. Fine. Now the last thing here is that what is the story of T independent and T dependent antigens? Okay. What is the story of T independent and T dependent antigen? Dependent antigen. Okay. T dependent antigen. So these two things also you should know, that what is T independent and what is T dependent. In the previous one, I have told up what is the story of this. Okay, T independent antigens are very less. They are very less. More it is T dependent. Okay, means what? They take a longer route. They involve the T cells and then only the B cells are involved up. That is termed as T dependent. T independent is very less. Very less means only simple antigens like LPS, capsule, lipopolysaccharide capsule. They are the T independent antigen. And what about the T dependent one? They are the complex one. Okay, this particular one is dose dependent, dependent on dose. Then only it will induce the antibodies, and it is immunogenic over a wide range of dose. So dose is not a problem here. Okay, which antibodies are produced? IgM and IgG3. Which antibodies are produced? IgM and IgG3 only, not all the lineages, only IgM and IgG3. They are being induced up. Here, all the antibodies they rise. In this side, all the antibodies they rise. So that is what is the story of T dependent. Fine. In the side of T independent, this is T independent. Okay. No memory is there. Once a particular antigen comes, it doesn't have any sort of a memory for the future one. So no memory, no macrophage processing because it is a shortcut. Okay. And shortcut doesn't work in the life. So that is what is there. No memory, no macrophage processing. And this is not rapidly metabolized. Guys, this is slowly metabolized. That's why the immunogenicity is less. Okay, it is slowly metabolized, whereas this particular one, that is the T dependent, in this the memory is there, macrophage processing is seen, and it is rapidly metabolized, means immunogenicity is very high of the T dependent ones. And you know, a typical example that is of a virus, Epstein-Barr virus, and this Epstein-Barr virus directly acts on the B cells and leads to what? Polyclonal B cell activation. Means Epstein-Barr virus also acts as what? T independent antigen. Okay, and directly acts on the B cells. Why? Because it have these particular receptors. Which receptors? CD21 CR2. CD21 CR2. So that is what is the story of what? Epstein-Barr virus along with these LPS and capsule. And in the body, which antigens are more T dependent or T independent? So guys, answer is T dependent antigens are maximum. Few antigens, simple antigens, they behave like a T independent one. So they believe in what? They believe in shortcut, and shortcuts does not pay in the long run. They will not fetch you a very good rank. Okay. So that is what is the story, that you have to go to the subject expert, then only the real result will come. Otherwise, you will be staggered up in the ranks for sure, because competition is so stiff for the best of the seats. Okay. Because what happens in T independent, when you try to take a shortcut, not every antibody will come. It is hardly IgM and IgG3. Okay. So if you want that your rank should be perfect and you get a seat of your choice, then you have to be what? T dependent. Okay. Then only all antibodies of yours will rise and you will achieve a wonderful rank. Is it fine, guys? So this is what is the story of the antigens in short, which you need to know. Okay. Which, like, what are the new thing you have got? That everybody knows that TSST1 is a super antigen, but these fellows, food poisoning ones, and they also sometimes may behave like a super antigen. This is a new thing which you should remember. Okay, even these important viruses, rabies, HIV, CMV, Epstein-Barr virus, they behave like a super antigen, but sometimes, not always. So this also should be clear to you. Okay, we have talked about the super antigen. They act on the lateral side of the V beta domain of the TCR on the V beta domain and activates more than this much. So this also is very clear. We have talked about the heterophile antigens also, guys. And the heterophile antigens, you know, what are they? Which are born up in different families this time, but previous birth relation they had. That's why they are used up in these particular heterophile agglutination tests. And one of the typical example is Wheel-Phallix test. Okay, and these are the various factors which affect the immunogenicity, which we have discussed up. We have discussed up the various definitions also, like antigen, hapten, and epitope. Okay, so guys, in short and sweet way, this is the best which you can have in the antigen. And if you write up this much also, then you will able to achieve the very good marks. And in fact, you will able to do all sorts of MCQs also. So thank you so much for this short and sweet session. Thank you. And do put up the comments like how you like it and which all things you want to add upon. Okay. So thank you. See you.